For too long, women's healthcare has been built around systems that just don't see us, treating our symptoms in silos and really missing the whole story. But companies like Progyny are breaking that mold. They're not adding more apps to the deck, they're building systems that finally put women, yes, we know we are superheroes, but we're also just human. And Progyny is putting women back front and center.
We're entering into a new era of women's health innovation, and it's one that has to blend the clinical depth with digital tools, but not forget the human. A lot of times, more technology on top of more technology, it's not really helping. It's not smarter. It's forgetting the personal care. And that's one big thing that Progyny never is letting go of, is the human care delivery piece.
We're not asking for more. Women are just asking to be seen, to have care that really understands that we aren't superhuman. We're just trying to live well in the bodies we've been given. And today, my guest, Joanna Balogh-Reynolds, shares just how Progyny is doing that for women. Thanks for listening. We are so glad you're here. Today's guest is redefining what women's health looks like at scale and at the seams. Joanna Balogh-Reynolds began her journey as a transplant ICU nurse, where she saw firsthand the complexity of the human body and the cracks in our care system. Now, as VP of Product Strategy at Progyny, she's leading the shift from fragmented, system-based care to integrated, life-aware support. She's worked with players like Amazon's Health Hub, Cigna, and National Health Plans to turn data into real impact. Her mission? To build care that understands the whole woman, her health, her work, her life. Joanna, welcome to Redefine Her. I'm so glad to have you.
Yeah, thank you so much for having me.
Yes, it's great. Tell me a little bit about Progyny, and for our listeners who don't know what Progyny is.
It's such an exciting origin story. Women trying to have children, it was considered a non-essential health benefit, actually is still by definition a non-essential health benefit. And so many women had no access to real fertility care that is clinically driven. So the decisions are made by clinicians and not by how much money you have in your pocket. And so Progyny started as a couple different companies that came together, and in 2016, they created a benefit for fertility care that was not looking at a cost cap. So actually doing things like carrier screening and doing things like real fertility care, solving a couple of problems. Progyny came together in 2016 to solve a couple of problems. There was no network. There was no access to physicians based on quality, and people were seeking care and making healthcare decisions based on money. And so we never want that to happen. Progyny then created global healthcare benefits for infertility, started to work with companies like Google and Meta to figure out how to bring this to employers and employees. 2019, we went public, and now we serve over 7 million people, both in the US and globally.
Which is absolutely amazing. And as you said, it was your origin story. So many of our guests have really shared how these unconventional moves really became career defining for them. And you made a huge transition. Obviously, you had a step between being an ICU nurse into this role. But looking back, what really helped you trust that that leap was the right thing to do?
It's kind of that really simple thing when you're younger. You're like, this is just wrong. This is not how this should work. And you're not thinking through things like macroeconomics and politics and capitalism, etc. But it just working at the bedside, I could only impact one human being at a time in 12 hours. Going and breaking the system and fixing it again, I can impact millions at one time. And so I just knew there was something wrong.
Amazing. It's like just right in your heart, like a calling that is there. Totally. I'm currently working with a cohort of career pivoters in women's health, and I'm one myself, and it can be daunting getting in. And I keep looking at all of these people who are in these positions, and they've got these amazing degrees. I'm like, oh my gosh. But when your work is like mission driven and it's your calling, it really changes everything for you. It's like, I can't not do this. It's just, I'm called to it.
And I had no idea what I was doing either. I just kind of, threw something at the wall and it stuck. And here I am 15 years later.
Tell me a little bit more about that.
It's funny. I wanted to go back to school for anesthesia. And I always think this is a pivotal thing. If I would have gotten into anesthesia school, where would I be now at 40? Very different life, probably. But I didn't get in. And I was very just apply again next year. And I was like, I don't like that process. That doesn't make sense to me. And so I started thinking, what can I do? What can I do to kind of change the narrative? So I went back to school, got my master's degree in leadership and management. It's like, okay, that makes sense. I was working 12-hour night shifts in the ICU, getting off at 7 a.m., going straight to another hospital to teach a bunch of students, and then go to bed for 4 hours and do it all again. And I thought, I have 2 degrees, a board certification. I'm still an hourly paid individual, and I cannot progress my career. Started to apply to a bunch of different things. And it was funny. I said to my, at the time, leaders and people that were helping me in my career, what is case management? Why would they hire nurses at insurance companies? Why would nurses be in business? And not a single person could answer the question. I applied, had a weird interview. 2 months later, they called and offered me the job. And I remember coming off of night shift, really bad night shift. I'll never forget the patient and everything. On Monday morning, I go to sleep at 9 in the morning. I get a phone call from recruitment, and they're offering me Monday through Friday, 9 to 5, no holidays, no weekends, and a big bump in pay with benefits. And I called my husband, delirious, and he was like, what are you doing? Say yes. And I went, I don't know what the job is. He goes, you'll figure it out. You're smart. And I was like, okay. It's so funny. He works for a Catholic university, so they are off for 10 days because the university's closed over Christmas. I called in to run out the schedule. The hospital told me not to come back. And so I love, this is my favorite story to tell people because we were such kids 15 years ago. My husband came home with a case of beer and a Nintendo Wii. And he goes, we're going to just be on vacation for 2 weeks until you start your new life and you don't know what you're doing. And so we just played Mario Kart with our dog in the basement. And here I am 15 years later on a podcast.
Where you're like, dang, we actually should have gone to, I don't know, Greece.
Like an island. Well, actually, I'm going to Greece next month for my birthday. So
oh, perfect.
It's coming full circle.
It's totally coming full circle.
Yeah.
That's awesome. You have this really unique lens from your time at the bedside, and that's a hard job. I mean, especially what you were doing, as you just alluded to, like a really hard night shift and patient. But coming into this role, you get to bridge that clinical empathy with systems thinking, and that can be something that many leaders miss. How has that experience shaped how you now approach leadership and innovation at scale at Progyny?
In the insurance world, I was still very clinical. And then even as I shifted from there to consulting, I was still in a population health management job. At Progyny, I'm product strategy. That is not clinical. Now, like you said, you have to have a clinical lens because we're in healthcare. So what has shifted for me is I like to lead clinically in my head, but when I'm talking, I have to make the business case for why you would do something. So passionately, we all know that we need menopause care, similar to why in the world did we treat fertility like it wasn't a healthcare diagnosis? And so here we are in menopause, and trying to make a business case for menopause is hard. There is no data. Women have not been studied. And then how do you make money? We're a publicly traded company with shareholders. And so you do have to think about all of those pieces and where it's going to be in 18 months and where do you invest versus how it's going to return on said investment. And then you do that part from a business standpoint, but then you got to go sell it. And then trying to sell something that doesn't have a historical backing, it's not cancer. And so how do you do that with employers?
Round peg, square hole.
Yeah.
Very difficult uphill battle.
In an economic time where everything's cut right now.
Oh my God. Yeah. I love that you've really never let that clinical perspective be erased by strategy. And it's really still the heartbeat of how you're building. And you've spent some years advising payers and plan sponsors on benefit design and health equity. What did that teach you about the real barriers that women face in getting quality, connected care?
I love that you said connected care. One of my favorite things to say about women's health care is we have commoditized it into multiple different specialties versus men get to go and just get primary care and everything's done right there for them. But when you think about talking to plan sponsors, their benefits, it's health and welfare. So they are looking at their medical claims, but there's also disability, there's leave, there's retirement. It's a whole package. When you're starting to stitch together this discussion, if you don't pull all those other pieces together to tell the clinical story, then you're kind of missing the boat. A good example is if you're thinking about somebody with a high-risk pregnancy that eventually may end up on bed rest, which is actually an old practice, but still happens. You're not just impacting medical claims, but now you're taking someone out of the workforce. You're putting them on disability. Now they're on family medical leave longer, and then that's impacting their partner who has to take on far more at the home. And so maybe they're coming out of the workforce. If you don't stitch all of the economic pieces together to tell the right story, then you're never going to have the decision-making power because you're talking to a CFO and you're asking for money to do something correct in healthcare. So you've got to pull the whole picture together.
And you can't solve for fragmented health by offering fragmented solutions. And integration really shouldn't be a feature. It should be a necessity because it really is. As you're looking at that whole big picture, yes, we are all complex humans, but how does Progyny really put that into practice to solve for the whole continuity in care?
When I came here, I kept hearing the word clinically integrated network. What does that actually mean, though? A lot of people will say that. So if you talk to a carrier, what does their actual network management strategy mean? And so when I was at the carrier, that's when we were launching value-based care. And value-based care is a word that's thrown around and attached to kind of everything. And once you've seen one value-based care contract, you've seen one. It's a trope to say that, but it's the reality. And so when I came here, I was doing RFPs. So I was doing evaluations for large state government plans. And I was evaluating all clinical programs against each other, all their financial models, so spreadsheeting left to right. One thing that kept standing out to me was how the network was built and how they worked together to pull this member all the way along the care journey to get the outcome of a healthy pregnancy. That to me is the best way to go about things. So if somebody says to you, I own care delivery end to end, you don't have to go anywhere, one-stop shop, they're lying. And they're putting something on top of a fragmented system. And whenever you don't have the right foundation, you're going to fall through the cracks no matter what.
And so how are you changing that?
In healthcare startups, I think a dirty word is partnership to them. To most startups, because they're naive. They think they can build everything themselves. The reality is that's not how our country, our healthcare works. That's not how capitalism works. You have to partner. And you don't have to be the expert at everything as long as you don't have the hubris to think you are. And so pulling in really, really good people at the right points of care is where you're going to get that unfragmented experience for members and outcomes.
You guys are really leaning into integration behind the scenes with partners, Cigna and Quantum, and you're using detailed engagement and outcomes data to really inform care management strategies. That kind of alignment can change everything. So benefits start talking to each other and care becomes more coordinated, and ultimately the member really has a much better experience. Their health outcomes improve. How hard is it to get partners to truly integrate into your model?
One, how you're approaching the partnership. So you have to see it as a true integrated partnership versus just a referral. So a lot of times people say we have this deep partnership with somebody, and then you get underneath it and it's just like, here, Brenda, go to this link. Good luck.
See you later.
So, bye. I have no idea what's happening to you over there, but I know it's great.
Hopefully you can get some help somewhere.
And hopefully you can even log in and the link is real and it's not going to take you to steal your money somewhere.
Exactly.
The partnerships have to start on both shared values to the outcome, defining what success and outcomes look like to each partner and for the member. But then what is that member experience? How are you integrating data to inform that member experience? And so that's how you make a successful partnership.
Love it. You guys did do a recent Data survey, which uncovered something big. And this is really more to the point of the weight of being a woman at work. 85% of working women are dealing with symptoms that impact daily life, and most of them aren't getting the support that they need. What did that data from Progyny's recent Data survey really unlock for your team and for yourself?
The hill I will die on is pelvic floor therapy and pelvic floor dysfunction. 70% of women will have a pelvic floor dysfunction at some point in their life, whether that's an underlying clinical condition that we either just realize is a thing in healthcare and or haven't figured it out in research yet, or it's something as simple as I'm pregnant and now I need to recover and come back to work. What unlocked in people's brains is how many women are walking around in acute pain constantly and still functional and at work. And so how much we've dismissed and suppressed is something that unlocked through the data. Somebody said to me 2 years ago, Joanna, if this is so pervasive, why have we not solved that yet? And I went, because we're women and it's women's healthcare. I said, this is the world we live in.
The system is not built for us.
Correct.
Yeah, like get 10 of your girlfriends together and 7 of you have some sort of something going on. But even in our small circles, we don't talk about it nearly enough.
Generational might be different. I have a group text with my 3 best friends that we see each other maybe a couple times a year, but there's not an hour in the day that we don't talk to each other. My one girlfriend I met in kindergarten, the second one I met in middle school, the third one in high school. We all went to college together. Now we all have families and lives and all over the different places of the globe. One moved to Sweden and then back. And I bring that up because that is the group I go to ask about how do you get car insurance negotiated correctly, but also why do my breasts hurt right now? I don't understand. I think that's why our generation is more vocal about it. We're more comfortable talking to each other, and we find the people that we need because we can't find the information the way traditional people find information.
I have to so agree with that. I remember my sister-in-law, it's been a couple of years now, and she would probably not appreciate me saying this, but she got a Menopause for Dummies book. This was 10 years ago. And she just threw it out the window. She's like, oh my God, this is already annoying. I don't need to talk about it.
I hate all of this. And why is this happening to me? And men just get to wake up and exist. It's so unfair.
It's so unfair. What do a digital psychiatrist, an AI health coach, and a pelvic health game changer have in common? They're not sci-fi, they're real, and they're redefining care for women today. On Redefine Her, we sit down with the innovators behind Talkiatry, Wave, Joylux, and many more, founders who are flipping the script on women's health with heart, grit, and bold ideas. If you're into big conversations and even bigger missions, hit like, subscribe, and leave a review. Even if it's a love letter or a strongly worded rant, seriously, we read them all. Find Redefine Her wherever you get your podcasts and come help us rebuild this industry from the inside out. Thanks for listening. Let's keep redefining her. Something that we talk about on the show and that I talk about in my circles, and you probably do too, but not nearly enough still in corporate America, is really how hard it is for women to show up. So many are navigating work and caregiving, and then these chronic symptoms, hormonal shifts, doing it invisibly, and we just keep trudging along. In fact, it's nearly 1 in 5 women are considering leaving the workforce because of menopause symptoms, and 40% cite burnout as a top reason of stepping back, according to Kenzie's study. How do you think we move beyond offering more point solutions, because as we talked about, it's pretty fragmented, to offering that actual continuity of care?
6,000 women a day enter menopause, and there's less than 2,000 certified menopause trained physicians in the country, let alone globally. And so when you think about that, it is half the world's population is kind of dealing with this. So I used to say when digital health became a thing, we saw Livongo come out, Omada, that just went public. Livongo got sold to Teladoc. That was kind of the digital health revolution. And it did solve a problem 15 years ago. But what has happened, and what I used to say as a consultant, is not just a woman, but think about diabetic. I am a diabetic. I now have 7 different apps just for one body and one diagnosis. Women have always had that experience. Like I said, women's health is not primary care, and it should be. So when you think about that, having fragmented applications, fragmented digital experiences that manage my sleep, my breathing, a different one for pelvic floor therapy, a different one for my mammogram scheduling. It all needs to come together somehow. And that data sharing is really interesting. So we're entering into a new era of women's health innovation. And it's one that has to blend the clinical depth with digital tools, but not forget the human. A lot of times, more technology on top of more technology, it's not really helping. It's not smarter. It's forgetting the personal care that is talking to someone about their dog and their family, but also then helping bring them along and connecting all these systems together. And that's one big thing that Progyny never is letting go of, is the human care delivery piece.
That's absolutely amazing, because 10 apps for 10 different things is not serving us.
What's interesting about what technology outside of healthcare got right is Apple Health and Fitbit and Oura. You can share all of that across everything now in your phone and have one sort of hub, even though you have an Oura Ring and maybe an Apple Watch and maybe something else that you're pulling together. Healthcare has been really bad at that. You lean on HIPAA and say, I cannot share this data across multiple applications. And that's where you have 6 different apps just to manage your daily life. So that's where we need to go. Companies like Progyny, companies like Oura and others, we're coming together and seeing that and trying to break those walls down and show that you have to do that to manage health.
If you look at it from the end user's perspective, women aren't looking to manage more. They're looking for something that finally holds it all together. But one of the complexities of all of that is all of these different entities own different data, and it's a real challenge to get them to release that ownership because it's a business. That goes back to partnerships and aligned vision and like doing the right thing for primary care for women's health. Can't we just do that and make it that easy?
That, and you need to have it be a relationship with your provider. It can't be this round robin, I call in and I get whomever is available to manage my healthcare. That's great whenever I have a UTI. My favorite thing is at UTI, right? For women, it used to be, okay, you have to come in and make an appointment, and you can't get an appointment for a couple of days, and then you have to do this urine screening. And I remember talking to my doctor on the phone, and she was like, why do you think you have a UTI? I was like, because I'm a woman in my 30s and a nurse. Can you just prescribe me what I need? So we have made advancements there. We have the first self-administered cervical cancer screening test that came out and is approved in California. How long have we been doing pap smears the way we've been doing it painfully, and IUD insertion? We're just recognizing pain. So it's just been a really ignored space for a very long time.
Yeah. I had a physician say to me one time, oh, this doesn't hurt. It only hurts for like 1 in 10 women to have a pap smear. And I'm like, I am that 1 in 10 woman. That is me.
This is my favorite story. And this is back to the, you need your crew of people around you. So I had an IUD slip, and first of all, getting it inserted, oh my God, getting it inserted is the worst. But I had a female OBGYN, and sadly she moved out of state. I have not replaced her yet, but she would come in and go, there's my beautiful vagina. How are we doing today? And like, as a woman, you're like, oh my God, what's happening? She's like, I have a student, come look. And I'm like, sure. And so we're all in there together. She's just talking to you like we're at a coffee counter. And so she made it so comfortable to be in that uncomfortable situation and position that is just primary care, right, for women. So we placed the IUD, we sat and had this whole conversation, and then I never had one. And I remember talking to my friends, and they're like, it's like getting kicked in the stomach with a steel-toed boot. It's going to take you a week to feel better. And so I walked in to the appointment. She's all excited. And she's like, hi, how are we doing today? And I said, I'm really nervous. I don't think I want to do this. She goes, why? And I said, it's painful. And she said, not the way I do it. And what's interesting is the way that she placed IUDs was, one, she prepped you, take this much Motrin on a schedule leading up. So number two, she used a drug called Cytotec, which is abortion suppository. So it's softening the cervix, opening everything up, and making everything easier. And it actually really wasn't that painful the way she did it. Then 3 years later, it slipped. I had to have internal ultrasound, which was an interesting experience. And also, can they make that smaller, by the way, the ultrasound? So they found it. Then I had to have it replaced. So I went to more of a clinic. I went to a male with no preparation. And by the way, prescribing Cytotec now goes against laws by state.
Unreal. That's a whole other thing we can talk about.
That's another podcast. It's another day. But I remember specifically, I went in there, we had this discussion. He's asking somebody for a certain type of forceps because of where it had lodged. And her response was, yeah, we have that. And he goes, can I have that? And she was like, oh, I don't have it here. And so now I'm sitting there with multiple instruments inside my body, making conversation about vacation. So then we finally get through the whole process, extremely painful. And I sit up and he goes, would you like some Motrin? And I was like, dude, I took 3 muscle relaxers before I came here. I don't need your Motrin. But then I texted my friends because I was on my way to get my car. And every male that I saw, I was instantly mad at for no reason, just because of the experience I had just gone through. And this man was trying to pick my parking spot, and he goes, ma'am. And I was like, what? Yeah. Are you leaving? Can I have that space? And I was like, oh, sure. I'm so sorry. Let me get out of your way. And I was driving home infuriated. And I looked at my husband and he was like, what's the matter? And I was like, I hate you right now. Because they will never even know. Something as simple as birth control can be so painful.
So painful. I know. I had an IUD stuck in my cervix for a year and a half and did not know.
Oh my God.
It fucking hurts.
Oh my God.
It's the worst.
It's the worst. And they use hooks to pierce your cervix to open it. Now there is a new innovation that's a suction that was made outside the US. They're now coming to the US, but I actually went to a really interesting event and they showed the creation of the speculum, the innovation of ED against the speculum, the innovation of phones, of communication against. And so in over 100 plus years, we're still using the same device.
Thing. It goes back to our point of the system has been built without us in mind. And it's changing, though.
It is.
We were talking a little bit about our Oura Rings, but a tech that actually understands women. This is an exciting time right now. We have all of these new partnerships, and specifically, you guys, Progyny, has partnered with Oura Ring. And so you've got a whole roadmap for integration for this coming year. What have you learned about wearable tech and women's health that really has surprised you?
Well, I learned personally that I sleep like shit, apparently. But in all seriousness, though, these wearable technologies were created mostly for performance. And if you think about sports performance, it's men in mind. And Oura was really interesting during the pandemic. The NBA used them to see if somebody was spiking a fever because they're getting sick. And so this was their way to get back in person. But then this fun discovery of temperature highly predicts not just your health for all people, but highly predicts your ovulation. What people forget is reproductive health, sexual health, reproductive hormones, both for men and women, impacts your health across your life spectrum. So cardiometabolic, we're now tying neurological health to menopause and early treatment of menopause, as well as musculoskeletal and all these other areas. So when people think about investing in something like fertility, they think of it as an added cost. It's just essential. But all of this data that women haven't had before is very actionable to then impact your health later on in life. What's interesting is I was having a conversation with Oura. We were having this discussion about women's health in general. You know, they have this happy discovery of, oh my God, this predicts ovulation. This can now help you manage your PCOS and your pregnancy and all this kind of stuff. But women are actually way better at data than we think because we've been tracking our cycles on a steno notebook probably for years. You've been doing it on a calendar. I remember being younger and watching Sex and the City, for example, and seeing an X on a calendar and her being confused and think she was pregnant. At the time, I wasn't connecting it, right? Because I was maybe a little bit too young watching that. But think about that. If men had to manage their life around a calendar, this technology would have been out years ago. But now I can just look at my ring and I'm packing to be in New York and I know if I have to bring different clothing because of my cycle changing. But it was so wildly accurate in the testing period. So I started wearing it and I report to a man. And men are fine, but I report to a man and it's Friday night.
And we need men. We need men in our life. We need them to advocate for us. Totally.
Exactly. So it's Friday night and I had been wearing the ring maybe 2 months. And I'm putting all my data and I'm like, there's no way this can predict my cycle is starting in 6 hours. I was like, you're fucking crazy. And so I put my phone aside and I go to the bathroom and I was like, oh my God. My husband's like, are you okay? And I went, I started my period. And he was like, thanks for sharing. What do I do with that information?
This is crazy. Like spot on to the T, time-wise.
Spot on. And I'm lucky. I do ovulate pretty regularly, but I texted my boss, who's a man, on Friday night at 10 o'clock. And I was like, I got my period. And he was like, okay. And I went, no.
Overshare?
Yeah. And he was like, why are you telling me this, Joanna? And I went, no, look. And I sent the screenshot of what Oura told me. And he was like, well, that's fucking cool. And I was like, it really is fucking cool. And so what's really neat about all of that data is we haven't even unlocked the potential yet of what that can do for health, predicting cancers, predicting autoimmune disease that mostly have been told women you're lying about. You're not having that, but 80% of autoimmune exists in women.
Yeah.
So it's going to unlock a lot in the future. And then now I can self-manage. I can self-advocate. I can go to the doctor and say, no, I'm actually experiencing these symptoms. And here's why I know that.
Yeah. Or even like simply the reminder that if I have too much wine and I wake up at 1,000,000 degrees, my sleep score is going to show it. And I'm going to be like, oh, I guess it might be because of that extra glass of red wine.
Yeah, and I love the Aura insights too, because the early days of wearables were like, hey, fat ass, get up and go move. Like you are a terrible person.
You've only taken 7 steps today.
Yeah. What are you doing? Aura is so great because we all have bad days. It's okay, Joanna. Try a little harder, maybe. But if you don't want to, that's okay too.
Totally, totally. I love how you're framing it, and overall is like we are good at data, and this doesn't have to be data overload, but it really is insights that can drive action for the future.
Yeah. And your body doesn't have to be a science fair project.
No, because it's not. We are just women working in a system that still treats our health in silos, and it's crazy. Hi, ladies. Thanks for listening to Redefine Her. I wanted to share something with you about In Women's Health. If you're building, investing in, or working in women's health and want to lead, then the In Women's Health Mini MBA was built just for you. This 6-week high-impact program gives you a behind-the-scenes understanding of how the industry works. From payers and reimbursement to policy, marketing, regulation, and more, you'll learn directly from industry leaders at companies like Kindbody, Genev, Portfolia, and many more. Whether you're pivoting into women's health or scaling a company within it, this MBA-style experience helps you gain clarity, sharpen your strategy, and connect with a powerful network of operators, clinicians, and investors. Better yet, I've got an affiliate code for you. Visit inwomenshealth.com and use Brenda Armstrong 100 to save $100 and reserve your seat for their next program. What do you think that the emotional and systemic cost of the fragmented system that we currently have is for women?
I would love for us to be able to actually study how many people have left the workforce, how many people have left really good careers that they're good at because they just can't anymore, and where we would be as a society if those women were in those roles and advancing technology, advancing economics, advancing equity. I almost feel like we're living in a stone age in modern society.
Yeah. If you look at the cost of productivity and loss when you're even trying to replace someone, and that knowledge base that leaves the workforce with that woman, that one single woman, I mean, it is profoundly impactful in a detrimental way to businesses.
Yes. And if you think about women are getting pregnant now later in life, and some are borderline or in menopause, postpartum. But that is also the core part of people that you need in those career jobs. So if you think about sort of the hourglass, that's that middle of the hourglass that is very thin at many companies. But to your point, they're also the one that is bringing all the base knowledge. They're also the ones that are doing all the work to advance the company. So they're not on the bookends of their career.
Right.
And we can't keep them.
And I'm glad to see companies putting in effort to change that model because it's clearly not working, and we do need to keep them. We need to figure out a way. I'm glad there are a lot of brilliant minds out there coming up with things. I just spoke with Midovia, and they are trying to do more menopause training and advocacy for accrediting workforces. And I mean, there are a lot of things that are so exciting, but we are still so far behind, and it's 2025. Like you said, we're not actually living in a stone age, but damn, it feels like it some days.
I think as a leader, if you're honest with people about what you're going through and how you're feeling, it allows them to be honest too. And it makes it a much easier conversation at the leadership level. You were talking about Midovia doing that career counseling. When I was a consultant, we had started working with clients and talking about mid-level leadership being your most critical people in culture, both helping managing up and below. We had work groups with really senior companies. And one of the things that we walked away from was career training on healthcare issues had to be part of manager training, and how you respond and how you react to something that people are bringing you. I'm not showing up to work because this is happening, and caregiving and all those other things.
It's fortunate we're living in a time that is on the table. These conversations are happening.
I mean, if Katy Perry can go into space, I think we can figure out how to manage menopause at work and talk about it.
So Progyny's includes menopause and pelvic floor therapy, so needed. Why is it essential to build this for the full continuum of healthcare for a woman's health journey?
I like to think about the products that follow her versus putting them in these buckets. So think about pregnancy for a second. Women still have to go on short-term disability to have a baby. because we're treating it like you got cancer and now you're out. You're choosing to grow your family, and you need benefits to support that. So it's looking at benefits from a unique lens and breaking down the stereotype of not talking about that at work. And you just need to toughen up. Where the reality is your body's going through a constant shift, and maybe you're in a meeting and you're having a disconnect on what's that word. I was in a meeting and I couldn't remember a word around male ED, and there was only one man on the call, our president, and I'm like, what's that thing? What's that thing? You're a guy. And I said, oh my God, that was the first time in my life that I had a real medical term just fall out of my head. And one of the conversations that we have to have is it's not a cognitive decline. You're not losing IQ. Your hormones are disrupting the connection in your brain. And how do you do that as a female executive at a board meeting or at a shareholder meeting? You've got to make space to have those conversations and make it okay to have that moment and say, I need a minute.
Most definitely. And the other piece to all of that, which we don't talk about enough, is, as you mentioned, the hourglass and the women in the middle that are actually doing the work all the time. They also have families, or they are in the sandwich generation, and they are doing so many things outside of work as well, managing all of these different things. We need systems set up internally that talk about that. And we need to even talk about it more. I was speaking to a colleague the other day. She's got 2 little kids and she has summer schedule to manage. She's got all of the things outside of work, as well as the heavy, strong demands of a full-time role. But we don't talk about that enough at work either. Like, women in these leadership roles still are carrying a huge workload. So in essence, we have 3 full-time jobs, or 7.
Yeah, and when Progyny decided to expand to other areas of women's health, that includes clinical and non-clinical, caregiving, parenting, etc. And that was through our acquisition of a partner benefit bump. But when we decided to expand the roadmap, it wasn't unclear that we needed pregnancy postpartum support. It wasn't unclear that menopause was another area to go in. What was unclear was what happened to women after we got them pregnant. It was this great big hug is what I've heard it described. I was lost. I didn't understand timed intercourse. I didn't understand my ovulation wasn't correct. Now I have my Oura Ring and I know that it's not correct. Now I can time things correctly. Pulling all that together was a no-brainer. But what was happening is you have all this stress, depression, you see infidelity going up whenever people are going through infertility treatment because both partners are kind of frustrated and you're treating your relationship like a business at that point too. Right. And so we did this great thing of pulling everything together and getting people pregnant. And so did infertility clinics. But then you're pregnant and you have to go back in the typical system. You're still high risk. You're still going through mental and emotional stress because what if I did all this and then I lose the baby? And then also women put that on themselves. It's my fault. They have that feeling. But what was a no-brainer once we thought through that was we need to start from menstruation all the way through end of life and think about the woman through that whole lens, but also the non-clinical things that they're going through. And how do we pull all that together? And so women can just show up at work like men do. They just wake up and show up at work. How can we do that for women? And so that when we thought through that roadmap, all of these pieces just fell into place pretty logically.
Right. And I mean, again, like, it's 2025. How are we just now coming to realize this logical path? Often just a spark of an idea can really influence change, but to actually make it happen and make an impact, it takes a team of thoughtful operators. How do you like to build your product teams, and what do you look for in your team members?
Product strategy has to think about crazy shit 2 years in the future, but product has to lights on, doors open, and keep functioning day to day and then put fires out. So when you think about that cross-functional team, you need everyone to be in constant communication, even if I'm talking about wild shit that may never happen. You got to find the balance of how much to share, though, because if I think about strategy in 8 hours, and my brain never stops thinking about it either. I'll wake up in the middle of the night and write a note. I'm like, oh, shit, that was interesting. If you think about that, you got to find the balance of how do I not overshare the stuff that we're never going to do, but get people to think in their day-to-day work what something might look like 18 months from now. Because if you don't do that, then you're sitting there working on today's product And you're missing out on innovation from a frontline engineer that's just looking at this button and this problem that someone's experiencing. And so that information sharing and being in lockstep with each other, but also allowing space for innovation to come from any part of the organization.
I love how you put it that way, because when you do look at strategy, that is the big picture. And you have to continue to be inspiring and lead people to these realizations without maybe giving them the full picture, and effective through that time period, because you do need something right here, right now, but it can't be so short-sighted that it's also not going to work for 18 months down the road.
Here's my unlocked learning from the week at Progyny's offsite. So we're sitting in these rooms with different levels of leaders and having breakouts with each other. And it's a moment to put a magnifying glass back on yourself and say, how can I be better? And so one of the questions was, for each leader in this room, senior leader, mid-level executive, what can you do better tomorrow to improve your team's functionality and inspiration? I don't have a team. So strategy is me and my teammate, Karen, and she reports to me, but I think of her as a peer. And so we're kind of running around and constantly trying to figure things out, working with the whole company, but it's just two people. So we're in constant conversation. There's not a thing that she doesn't know. And so I'm not thinking about how do I have to foster this operational team to function? Rather, as a strategist, everyone's teams are my teams, technically.
Right.
What I have to remember as a leader is I bring baggage of trying to figure out the problem and make the business case and get contracts done for 18 months, maybe 2 years to work on something. It's the first time that person is hearing it. I have to give them space to be curious and not react to, why are you asking me this question? It is so clear, but it's not to them. It's a brand new piece of information and they're trying to process it.
That's a really great realization, though, because I was talking to my niece even yesterday and she was like, I just want to get shit done and people are too slow. And I was like, yeah, but you need to figure out how to delegate and like step back, because you're in your head, but they are too. And as you said just now, it's like they also need to be curious and have that opportunity to have that discovery.
And if you don't allow that, you're going to miss something interesting that you didn't think of.
Oh,
because you're
so
just
agree.
looking at yourself all the time.
So agree. Yes, and we can be blinded by our own direction. What would you say your proudest product milestone so far is? Or maybe one of those like, this is why I made this decision, coming full circle.
Going into 2025 and talking to our sales and client success teams and getting them excited about fertility. Love fertility. Progyny is miles deep. One of the biggest things we hear from clients and consultants is your non-clinical salespeople know more about fertility than our physician does that we use as a consultant. So we're so good and so confident. And so going into sales training and talking about pelvic floor therapy, talking about what happens postpartum with women, talking about menopause, and really there's 35 different symptoms, but what might bring a woman to the table to say something's wrong is my hair's falling out, because women are going to lead with that type of issue, or I'm gaining weight. Men lead with the penis. ED is an issue. Now I figured out that I have a cardiac disease, and so men end up coming in the healthcare system through that way. Women come in different ways. But now starting to see us, Progyny, and our teams talk about sexual and reproductive health as an essential healthcare benefit, and talking about women outside of a singular kind of problem and thinking about it longevity wise was just a great thing to see everyone start to kind of talk that way and think differently about what they do at Progyny.
Beautiful. It's like, it's so fulfilling.
It is. Yeah, it is. I mean, look, we make babies, right? We're a happy company. Somebody said to me in consulting, oh, you're going to be a vendor? Ew. And I went, we make babies. Come on. Like, no one's mad at us.
Like big hugs all day long.
We're not denying care. We're giving people care. If we think about that healthcare in that same lens and think about this longevity, then we're still happy. We're still a happy partner.
Most definitely. One of the questions that you wish more people would ask is, how did understanding the true scope of women's workplace health challenges change your perspective on healthcare delivery? So I would love to ask you the question, how did that insight shift your own thinking? And as a follow-up, what does it tell us that still needs to change most urgently in the way that we build care models for women?
when you're a health benefits consultant, you are talking to clients about health and welfare, all of these pieces, and you're putting everything into a box in a spreadsheet. This does not spreadsheet. This is such a complex issue. As we've talked about, the system's not set up that way. And so when an actuary is starting to look at things, it's really hard for them to see the underlying causes of these issues in claims data, because it's just so stagnant and so difficult. And so starting to knit that story together and think about things far more than just episodically and more longevity, then also pulling that whole story together from how it impacts your career, how it impacts how you show up at work, what are the benefits that support women outside of medical care. One of the exciting things that I've seen in other countries and some very progressive employers do is having bereavement leave for a miscarriage. That is something that people think are so, yeah, you had a miscarriage, you're fine. It's normative in some people's minds. Working in a consulting firm with mostly actuaries, a lot of men, I was talking to one of the consultants that's a SVP. So here I am as a director. I'm like, how do I get to there? And she's an actuary and she does retirement, so not healthcare. Having this discussion, and she was sharing this very stressful, intimate moment that she was at a board meeting, all men, at a labor union meeting, so men, actively having a miscarriage as she's presenting projections. This was 10, 15 years ago, and she said, I was so embarrassed and I was only traveling with male colleagues. I didn't tell anybody. And then I just went home and had to suck it up and go back to work and do all of that. So making that space, making things more normal to talk about, and recognizing that you did have a loss and you need to have time off to process said loss so that you can come back and show up as a whole person.
Yeah. And any loss that we have, our parents or an older child, whatever it might be.
A pet.
Totally. Pets are like the worst. Oh my God.
My dog's 17. I can't even think about it.
Oh, sister, it's coming. I'm so sorry.
Yeah, I know. Just like menopause is right here. I'm turning 40 and I know it's there and I'm trying to just go away.
Not yet. Not yet.
Not yet.
No.
I'm not ready. But you know what? If Halle Berry suffers from it, we all will.
We all do.
Yep.
How are you taking care of yourself while leading at the level that you do?
Not well. No.
Your Oura Ring also might need to say, Joanna, I'm going to kick your ass if you don't do some exercise today.
Yeah, it needs to yell at me a little more. My gym friends and my CrossFit friends
Yeah.
are like, Joanna, can you go back to having an easier job? Because you're never here.
Yeah. Tap that into Aura's algorithm, right? My girlfriends need me.
Yes. We need our Wednesday CrossFit and coffee.
Exactly. We like to pass the mic forward here, and our last guest left this question for you. It might sound a little morbid, but it's not. When you die, what do you want your gravestone to say?
I didn't give up.
Love it.
So we talked this week about our cultural pillars, and one was tenacity. And what I took away was tenacity is not just pushing through for the sake of pushing through. It's pushing through with purpose. It's pushing through with understanding to help pull people along. As the only women's health publicly traded company in the United States, we shouldn't look at our competitors as the enemy. We should look at them as, thank God you're here, that we are pulling women's health along together.
That is a beautiful answer. I really appreciate it because life is short and we do need to be more collaborative and do this together. And sometimes that requires taking a pause and that self-reflection and introspection. But the work that we're doing really does matter. So thank you for the incredible work that you're doing to make care more connected and compassionate and human. And this has been such a gift having you on RedefineHER. Thank you.
Yeah, thank you so much. I mean, I have to say, our team is a little bit of a fangirl of your podcast. So when they asked, it was, of course.
Love it. Well, keep listening.
We are honored.
Thank you. And I'm excited to watch Progyny's work evolve and really to better serve women. It's awesome to see. I've been deep in the women's health movement over the last year or so, and I'm just glad to be here. It's inspiring.
Same.
So thank you. Thanks so much for tuning in to Redefine Her. If this conversation hit you in the feels, share it with someone who's navigating their own health journey and deserves more than piecemeal care. Because redefining women's health doesn't happen in silos. It truly happens through systems built with real lives in mind. If you're seeking continuity of care yourself, whether for fertility, menopause, or whole women support, visit Progyny.com. That's PROGYNY.com. Progyny.com. Progyny's women's health and family building benefits deliver life-changing support, and they are backed by innovation, data, and compassion. Be sure to check them out, Progyny.com. Again, thanks for joining us. Thanks for making this possible. Thanks for listening to Redefine Her. Redefine Her is hosted by Brenda Armstrong and co-produced by Brenda Armstrong and Taryn Long, with community support from Ineska Viljoen. We're three women walking our own paths through endometriosis, PCOS, and perimenopause, and we created this show because we know how isolating, confusing, and overlooked these journeys can feel. Redefine Her is our way of changing that. We're amplifying the voices of women transforming health and wellness for women from the inside out. Thank you for listening, for sharing, and for being part of this movement. Be sure to subscribe, follow, and stick with us because Redefine Her is just getting started.